Hey everyone, Dr. Kuniak here. I wanted to take a moment to talk to you all about the subject that's coming up in our, across our next week here is related to assessment issues with diverse populations. So we touched on this a little bit previously, and the idea that uh, an assessment tool might be normed with a certain population in mind. So what that means is like the reliability and validity statistics that are gathered on that tool to say that yes, this is in fact a reliable instrument to use for anxiety, depression, coping methods, as an example that I've given before, things like that. Um, that it does tend to show up the way we expect it to. We've asked these questions in a way that gets back the answers that we expect from a known population. So we presume that then if you use this tool, you'll be getting the right information back when you're using it to figure out information. So with that in mind, let me really quickly just show you a definition of assessment generally, because I think it relates, and hopefully you're seeing this, my PowerPoint slide. This is on an intro to assessment PowerPoint slide that I believe is in the D2L shell. And if it's not, I'll add it the next time we talk. Um, but so what is assessment? It's the systematic gathering of information to make inferences about individuals. I would argue too that it helps us to make inferences about entire populations based on samples. It includes defining, selecting, designing, collecting, analyzing, interpreting, and using data to better understand an individual's thoughts, feelings, and behaviors. So yeah, it's that data gathering component to help us to make decisions based on the information that we're getting in other cases. So, with that in mind, if we think about diverse populations, a lot of times tools are made with a given population in mind. And I think some of that's natural. If you think about it, we're going to, assessments are made by people, professionals they may be, but people. And so we're full of all of our own biases and preconceived notions and everything that comes with us packaged in us. And so as we make a tool, we're asking questions or providing prompts that are based on, some of those underlying you know, thought patterns are going to influence the way in which we're designing questions or prompts. And so uh one of the ways we get around that is by norming the data, is by doing exactly what I just said. So we're taking that data and running it against different samples of people, noting the variables about those populations, as many as we can figure out, and then comparing and contrasting the results. And the larger and larger a sample of people we norm those results against, the more reliable and more valid the assessment tool is said to be. Um, I was always taught that if you have a sample of at least 30 people, you can start to presume variance in the population. You can presume that you're getting a sample with enough variability in it that that the results can be somewhat reliable. Obviously, more than 30 people is preferable, into the hundreds and maybe even thousands of people to start to make guesses about human behavior would be ideal. We don't always get that lucky, and it can take a while to gather that much data. Um, but so anyway, with that in mind, though, if you think of a natural sampling of human beings and how we get data samples, we're going to talk about this a little bit in an upcoming discussion. How do you get the data? Well, maybe professionals use the test and gather information and share it back to the researchers, or you stand in a shopping mall or something like that and just ask people to participate in your study, or you put an advertisement on radio, or TV, or whatever the case. Internet's probably the easiest now, but you get advertisements out there and you encourage folks to come in and take the sampling, or go online and take the sampling and get some information about it. But we can only ever presume that, so what you have to keep in mind is the people who come in and take that assessment are a specific population, of individuals. They're the individuals who are willing to take assessments. There are plenty of folks out there who are unwilling to volunteer their time for these sort of things, in order to gather data. And so as a result, we don't sample that population. For example, when I gathered my sampling for my dissertation and my most recent study, I was sampling a population of gamers, but I was doing it at a gaming convention. So one of the things that I had to own up to in the results of my studies was that this population sample is not I can't be sure that it's gamers in general. It's gamers that were willing to travel to a gaming convention. It's I had a large enough sample that I can presume that it's pretty reliable, but I can't be sure. And so that's one of those things that we have to kind of own in our study results. That in mind, diverse populations are sometimes a minority population compared to, the majority population, whatever that may be. And so as a result, we may not be getting a huge sample in our assessment tools when we're gathering that data. So that doesn't necessarily mean that the information that we're getting back is worthless or is not reliable in any way. It's just we can't be sure. And so as a result, one of the issues we run into when we're trying to do assessments on a diverse population is we can say, with reasonable certainty, we believe that these results are correct. However, there's some room for error. And so we want to kind of remain aware and vigilant with the results of the information that we're getting. And I think that's appropriate to talk to our clients about. Now, you're going to be doing a video reflection and demo and all that sort of stuff. And I ask in that for you to um, provide results to your participant. That's one of the things that I think you want to say is, so this assessment is telling me that you're at a moderate risk. I'm making it up. I have no idea what they're going to be, obviously. A moderate risk of anxiety symptoms or of stress, whatever the case may be, or a high level of stress. Now, it's important, and saying to them, it's important to realize that this could be off. So does that result resonate with you? Like, do you feel like it's saying something that is valid, that you understand? And see what their response is. And if they say no, but that's really interesting, well, what do you think about that? What do you think about the results? What do you think that it's not giving an accurate measure of how much you're stressed? You feel more stressed than this, you feel less stressed than this. What do you think it's picking up on? And then that leads to kind of a useful counseling conversation about the results of the assessment. Similarly, with a diverse population, you can say, what do you think it's missing? Do you think maybe it's missing something culturally that it's not picking up here? Because, for example, and I've used this example about diverse populations. I have relatives that are European that would use alcohol, drink alcohol at any number of meals. Some assessment tools will pick that up and identify a level of substance use, and that might be, but also it might be a cultural component. And so we have to get a little bit more information. We can't completely rely on a single assessment tool or even maybe a couple assessment tools. We have to use our other senses, our subjective senses, to make sense of that data and see if it makes sense or not. And if it doesn't, I think that's something we can own up to. You can still report the results of the data, but you can identify that this counselor, like if you were writing this up in a report, this counselor, has some reason to believe that that these results may be erroneous for this reason or this reason or this reason. We'd like to, continue to monitor for whatever, for additional information, different results, different ways of learning. But that doesn't mean that the data is useless. It's still telling us something. It's just maybe not telling us what we expected it to tell us. So anyway, that's a little bit of a discussion on diverse populations, how we gather assessment results, and kind of how the cross connection between those, like how those results can be useful, or what we need to do as far as our caution around gathering assessment results on maybe an untested assessment tool or an assessment tool that we really don't know the population that it was tested on. Whenever we're rendering a diagnosis, and we use assessments for much more than just diagnosis, but whenever we render a diagnosis, the DSM would tell us that we have to be cautious of things like substance abuse, cultural considerations, et cetera, et cetera, et cetera, because any of that could skew our observations, could skew our results, whether those be in a formal assessment or an informal assessment, just like a conversation we're having with our clients. I hope this was helpful. If you have any questions that come up as a result of this, certainly email them to me, or bring them to the next class meeting. But wanted to give you some content to consider. So yeah, I hope this was a helpful video. See you in class.